we are here to discuss previous year questions for dental anatomy and dental histology with your original guru, Dr. Ami Rawal. Right? So let's start with our first question. Usually we have first question from dental histology, always, that is from topic to development. But today we will start with dental anatomy topic. Right, so coming to our first question, ratio of width is to height of crown of permanent maxillary central incisor is, options are 0.4, 0.8, 0.6 or 1. So for coming to the conclusion for answer, first we need to know what is the width and height of crown of permanent maxillary central incisor. Height means what? This will be the height, that is cervico-incisal length of the crown. It will be the cervico-incisal length of the crown. Length of the crown. So for that you need to know the table which is given in your Wheelers. And coming to the width, width is what? This portion, right? This is width. Width means mesiodistal dimension, mesial and distal surface. So width is basically mesiodistal dimension. Length is cervico-incisal length, this, right? This is cervico-incisal length, and width is mesiodistal dimension. Mesiodistal dimension. So coming to the cervico-incisal length of the crown, which we used to study during our carving days, right? For carving, we used to mug up this measurements. So cervico-incisal length of the crown is basically 10.5. And mesiodistal diameter of the crown is 8.5. Here we can easily appreciate both the dimensions. So our answer will be basically, it is as ratio of width, means ratio of mesiodistal dimension 8.5 upon height, that is 10.5. So is equal to 0.8. Is equal to 0.8. So here the correct answer will be 0.8. Understood? So width is basically the mesiodistal dimension. Height is basically the cervico-incisal length of the crown. Cervico-incisal length is 10.5 and mesiodistal dimension is 8.5. So it is as width is to length, means 8.5 is to 10.5. So our correct answer will be 0.8. Right. Now coming to our second question. Histology question. What is seen between newly formed cementum and the resorption area? So what is seen basically? This can be seen in bone also, right? So they are saying, is it incremental lines of Salter, reversal line, striae of Retzius, or line of Hopewell-Smith? So basically, incremental line of Salter is incremental line of cementum, right? And this incremental lines basically depict what? Rhythmic deposition of cementum or any hard tissues. We have incremental lines for enamel also. We have incremental line for dentin also. Same way we have incremental lines of Salter, which depict rhythmic deposition of cementum. Next is reversal line. We will discuss reversal line later. Striophragis. Again, striophragis is what? Incremental line of what? Enamel or dentine? Enamel. This incremental line of enamel. So basically we are talking about cementum. So this can't be the correct option. This is basically incremental line of cementum, but it is depicting what? Rhythmic deposition of cementum. So this is also not the correct option, right? Line of Hopewell-Smith. It is not a line. Basically, it is a layer. It is intermediate cementum. It is neither characteristic of dentine nor of cementum. So this is also not considered. So our remaining option is reversal line, which is the correct option here. So basically, between the newly formed cementum and the resorption area, we have reversal line. This reversal line we can also see during the resorption and deposition of the bone. Right. So basically, surface of cementum may have resorptive areas, and in some areas there might be deposition of cementum. So this reversal line is basically present where the resorption has stopped and repair has occurred. So resorption has ceased and repair has occurred. So this reversal line is basically present in the areas where resorption has ceased. So our correct option here is reversal line. Now coming to the next question, it is very easy. Which of the following is not a succedaneous tooth? It was asked in recent INICT exam, November INICT. So options are 1, 6, 1, 3, 4, 5 and 4, 4. So basically, what are succedaneous teeth? Right. First, we need to know what are succedaneous teeth. So succedaneous teeth are basically the teeth which replace the primary teeth. Incisors, primary incisors are replaced by permanent incisors. So permanent incisors are basically succedaneous teeth. Incisors come central incisor and lateral incisor both, right? Then coming to canine, primary canine are replaced by permanent canine. Okay. Then we don't have premolars in deciduous dentition. So molars will be replaced by permanent premolars. So deciduous first molar will be replaced by permanent first premolar, and deciduous second molar will be replaced by permanent second premolar. Right. So these are basically our succedaneous teeth because they are replacing the deciduous teeth. Now we have remaining our molars, all the three molars, permanent first molar, permanent second molar and permanent third molar. They don't have any remaining deciduous teeth to replace, as all the deciduous teeth have been already replaced by the permanent teeth. So the teeth which are not having any primary teeth to replace are our non-succedaneous teeth, right? Non-succedaneous teeth. So non-succedaneous teeth will be our permanent molars. First molar, second molar and third molar. All the three molars are non-succedaneous teeth. So in this question, options are 1, 6. So this is obviously our correct answer. 1 represents the quadrant number and 6 represents the tooth number. So it is our first molar. Permanent maxillary right first molar. So this is our correct option. 1, 6. Remaining are what? 1, 3. This is canine. So obviously it is a succedaneous teeth. So this is not the correct option. 4, 5. 1, 2, 3, 4 means right side. Mandibular right. 5 means second premolar. So obviously it is not a correct option as second premolar is succedaneous teeth. 4, 4. First premolar. It is also succedaneous teeth. So the only option remaining with us is 1, 6, which is our permanent first molar, which is non-succedaneous teeth. Right. So succedaneous teeth basically replace our deciduous teeth. We always remember permanent molars are non-succedaneous teeth because they do not replace any deciduous teeth. They usually arise from distal extension of dental lamina. Non-succedaneous teeth arise from distal extension of dental lamina and succedaneous teeth arise from lingual extension of dental lamina. Right. So succedaneous teeth from lingual extension, which is also known as successional lamina. And permanent molars originate from distal extension of dental lamina. Now coming to our next question. Which of this is an immune cell in OMM, also known as immune cell in the skin? Immune cell, right? Immunity is basically antigen, antibody. We're talking about antigen presenting cells. So which are the antigen presenting cells here? Immune cells. Keratinocytes. These are keratin producing cells. So this is not the correct option. Merkel cells. What are Merkel cells? These are mainly pressure receptor cells. Merkel cells are pressure receptor cells. These are basically pressure receptor cells. So again, they are not immune cells. They detect touch sensation, pressure sensation, right? So they are not immune cells. They are, all of the three options are non-keratinocytes. Non-keratinocytes. They form only 10% of the cell population here in OMM. Right. But from this three, only one is immune cell. So Merkel cell is basically pressure receptor cell. It can't be an immune cell. So it is cancelled. Melanocyte. Melanocyte is basically melanin producing cell, right? It is a dendritic cell. It can connect, single melanocyte can connect to 30 to 40 keratinocyte cells. But its main function is melanin production. Last, Langerhans cell. So remaining is Langerhans cells only. So the correct option here is Langerhans cells. These are mainly antigen presenting cells. These are antigen presenting cells. They recognize the antigen, they provide it to the T lymphocytes so that they break them into peptides. So they are antigen presenting cells. They have immune function basically. So here our correct option is Langerhans cells. Immune cells are Langerhans cells. Correct option. Now coming to our fifth question. Concentric dark band all lines present in enamel are. So you can be given an image based question also. These lines we can appreciate here. This resemble growth rings in a tree, right? So these lines are basically what? Are they striophragmias, Hunter-Schreger band, imbrigation lines, or neonatal lines? So these are basically striophragzias. What is striophragzias? We have discussed recently. These lines depict rhythmic deposition of enamel. Right? They are incremental lines of enamel. They can't be Hunter-Schreger band because these bands are what? Light and dark bands, parazones and diazones. Basically, they're formed because of change in direction of enamel rods. It is an optical phenomena. So it is not Hunter-Schreger band. It is an optical phenomena. And basically it is formed due to change in direction of enamel rods. So it can't be a correct option. Imbrigation lines. This is basically a surface structure of enamel. It is also known as perikymeta. Perikymeta. They appear as transverse wave-like grooves on the outer surface of the enamel, parallel to each other. External manifestation of striophragzias. They are external manifestation. So this can't be the correct option. Coming to neonatal line. Neonatal line, again, it is an accentuated incremental line of enamel which separates prenatal enamel from the postnatal enamel. Right? So this can't be the correct option. Here we can't see any separation between the prenatal enamel and the postnatal enamel. So the only option left with us is striophragzias. And here we can see incremental deposition of enamel. Right? So basically, striophragzias are incremental growth or line or bands seen in tooth enamel. They represent what? Incremental pattern of enamel. Successive apposition of enamel. So you can go through the diagram as well. We can easily appreciate the incremental deposition of enamel. Here we can see these lines. And if it was neonatal line, then one of the line here might be accentuated, more prominent, separating the prenatal enamel from the postnatal enamel. And the prenatal enamel is of better quality as compared to the postnatal enamel. And Hunter-Schreger band usually appear dark and light bands because of change in direction of enamel rods. And perikymeta, this imbrigation lines of Pickerel. Imbrigation lines of Pickerel is another name given to perikymeta, which is external manifestation of striophragzias. So it is a surface structure. Now coming to our next question. Amyloblasts are originated from ectoderm, ectomesenchyme, endoderm, and mesoderm. So in recent INI-CET paper, it was a question there that calcified structure of the tooth arise from which layers? So it arises from both the layers, ectoderm as well as mesoderm. Right? But here we are asked about amyloblast. So basically a tooth arises from three structures. Which are the three structures? Enamel, organ. Here, just next to enamel organ, there will be condensation of cells, which are dental papilla, and covering both enamel organ and dental papilla is our dental sac. Right? So, amyloblast cells. Enamel is formed from which cells? Amyloblast cells. Amyloblast cell differentiate from what? inner enamel epithelial cells, right? So inner enamel epithelial cells are present in ectomesenchyme or enamel organ. Here we have columnar cells present, right? So these are our inner enamel epithelial cells. So basically they are present where? Inside the enamel organ. So obviously enamel is formed from enamel organ, right? So enamel organ is derived from what? Ectoderm or mesoderm? Ectoderm. So basically from ectoderm we get what? Enamel organ. This enamel organ has inner enamel epithelial cells which differentiate into amyloblast cells. And lead to the formation of enamel, right? So basically enamel is derived from ectoderm. Enamel is derived from ectoderm. And mesoderm is basically dental papilla is derived from mesoderm. So dental papilla forms what? Dentine and pulp. Same way dental sac is formed from mesoderm. So it forms cap, cementum, alveolar bone and periodontal ligament. Right? So basically ectoderm, from ectoderm we get enamel organ. Enamel organ consists of inner enamel epithelial cells which differentiate into amyloblast cells. These amyloblast cells lead to the formation of enamel. So here the correct option is A. Excretory duct of salivary gland is known as duct of, you should remember the names for all the duct opening of all the glands, right? Is it Rivinus, Wharton's, Stinson's or Blanded and none? Very easy question. You have studied this in physio also. You have studied in 12th also. So basically excretory duct of submandibular gland is Wharton's duct. Stinson is for parotid gland, right? Rivinus is for sublingual gland. And we have Bartholin's again for sublingual gland, which open near the submandibular gland opening, which is Wharton's duct. Parotid gland opening is Stinson's duct. It can be asked any other way. That here it is asked what? Excretory duct of submandibular gland is. So excretory duct of parotid gland is Stinson's duct. Sublingual gland is Bartholin's duct or duct of Rivinus, right? What are Blandin and none? They are basically anterior lingual salivary glands which are embedded within the musculature of anterior tongue ventral surface. So it was a very easy question, but you have to remember the names of its opening, duct opening. Dentine that is freshly laid over pulp is it predentine, is it mantle dentine, it is secondary dentine or circumpulpal dentine? It is freshly laid. It is said freshly laid over pulp. So it is basically predentine. Predentine is usually the first form dentine yet to be mineralized dentine. It is not calcified. It is not mineralized. It is yet to be mineralized dentine. When it gets mineralized, it becomes a part of dentine and new layer of predentine will be deposited. Mantle dentine and circumpulpal dentine are both primary dentine. right? Mental dentin and circumpulpal dentin. So these are both primary dentin. It is usually mental dentin is the first formed dentin, which is mineralized dentin. Then comes our circumpulpal dentin, which is formed before root formation. Then secondary dentin. Secondary dentin is basically formed after root formation. It has less regular and fewer tubules as compared to our primary dentin. But here it is as freshly laid dentin over pulp. So it is only pre-dentin. Before actual dentin formation. So it is yet to be mineralized dentin. Newly secreted dentin, which is unmineralized, is known as pre-dentin. It is identified in hematoxylin eosin stain as less stained compared to the intensely stained dentin. This is the diagram for pre-dentin. We can easily appreciate the pre-dentin formed near the pulp border. Now, we usually get a question from tooth numbering system. In 2-digit tooth numbering system, 33, we are not calling it as 33. It is 2-digit system. So it will be always called as 33. Refers to, so what is the 2-digit system? It is the FDI system, right? Here the first digit represents what? Quadrant number. Quadrant. And the second digit represents what? Tooth number. Tooth number, right? Quadrant, and the second digit is representing tooth number. So basically for permanent tooth, we have quadrant number as 1, 2, 3, 4. 1, 2, 3, 4. Right? This is the quadrant number. The first digit is representing the quadrant. And for deciduous tooth, we have 5, 6, 7, 8. So here we are asked 3, 3. So 1 is representing right, maxillary right, 2 is representing maxillary left, 3 is representing mandibular left, and 4 is representing mandibular right. So we are asked about 3, 3. So in this, we can easily appreciate 3, 3 is, 3 is the quadrant number, that is mandibular left. And another, the second 3 represents the tooth number. So 1 is central incisor, 2 is lateral incisor, and 3 will be our canine. So 3, 3 is mandibular left canine. So this is our correct option here. Same way we have tooth numbering system for universal tooth numbering system, Zsigmondian Parmenter tooth numbering system, right? But here we were discussing the 2-digit system, that is our FDI. If it is asked about quadrant system, then the quadrant system is basically Zsigmondian Parmenter notation system. Next question. Keratinocyte cell migration from the basal layer to the spinous layer is known as, this we have discussed in our live lectures also, our recorded lectures also, right? So, if this is our epithelium, these are our cells. Granulosum and last one is corneum, right? So basically we have basal, spinosum, granulosum and corneum. The cell will migrate from basal layer being a part of every cell layer, being a part of basal layer, being a part of spinous cell layer, being a part of granulosome, and being a part of corneum, after which it shed off. So it becomes a part of every cell layer. So this migration of the cell from the basal layer to the superficial cell layer is known as maturation. It is known as maturation. And the time taken for its migration from the basal layer to the superficial layer is known as turnover rate. So basically, this migration of cell from the basal layer to the superficial layer, replacing the cells that have been shed off, is known as maturation. And the time taken for this travel is known as turnover rate. It is known as turnover rate. Now coming to our next question. Mesial marginal developmental groove is present in. This groove is never leave us. It is very important. We have another mesolingual developmental groove. We have supplemental grooves, right? So this mesial marginal developmental groove is a characteristic feature of which tooth? Is it permanent maxillary first premolar? Is it permanent mandibular first premolar? Permanent maxillary first molar? Or permanent mandibular lateral incisor? Usually, permanent maxillary lateral incisor have palatoradicular groove. So this is not the correct option. Maxillary first molar has oblique ridge, transverse ridge, right? It has grooves, different type of grooves, mesiobuccal groove, distobuccal groove, central groove, but not a characteristic mesial marginal developmental groove. So this is also not the correct option. Permanent mandibular first premolar is having basically mesiolingual developmental groove. Mandibular first premolar is having mesiolingual developmental groove. Mesiolingual developmental groove. So this is also not the correct option because we are asked about mesial marginal developmental groove. So the correct option here will be basically permanent maxillary first premolar. Now what is this mesial marginal? From the word itself we can say marginal. So this groove will be crossing the marginal ridge. It usually extends from the mesial marginal ridge onto the occlusal surface. Here we can see this is the mesial surface. This is the groove. And this is the marginal ridge, mesial marginal ridge. So this groove is crossing the mesial marginal ridge and extending to the occlusal surface. Right? And in root also we can easily appreciate depression. So on the mesial aspect of premolar, we have two characteristic features. On root we have mesial marginal depression, and in crown we have mesial marginal developmental groove. right? So this is our mesial marginal ridge. This groove will be crossing the mesial marginal ridge and extending to the occlusal surface. So please mug it up. Mesial marginal developmental groove crosses the mesial marginal ridge and is present on the mesial aspect of maxillary first premolar. Mandibular first premolar has mesiolingual developmental groove. Now, again a question from tooth development, right? This is very common question. You can be asked about any stages as an image-based question. Bud stage, cap stage. You can be shown a diagram and to identify the stage of tooth development. So here, identify the stage of tooth development in this image. What we can appreciate here is formation of hard tissue. Here, hard tissue is formed. Always remember, whenever you see a formation of hard tissue, it is basically a advanced bell stage, because we cannot see a formation of hard tissue in bud stage, cap stage or early bell stage. Only in advanced bell stage we can appreciate the formation of hard tissues. Here we can easily appreciate the formation of hard tissue. So it is advanced bell stage. As in advanced bell stage, we have what? Reciprocal induction. We have reciprocal induction. So basically, because of the formation of hard tissue, it is advanced bell stage. If some another diagram is given but hard tissue you can appreciate, then it is basically the diagram for advanced bell stage. Always remember this. Cap stage, on the basis of the shape of the enamel organ, you can easily appreciate bud stage, bud formation, right? So advanced bell stage is basically hard tissue formation. Well, we can see reciprocal induction. Under the influence of inner enamel epithelial cells, dental papilla cells differentiate, odontoblast are formed, dentine is formed. And under the influence of dentine, enamel will be formed. Again, a DA question. Tooth morphology varies according to the tooth. Which cusp of maxillary second molar is the smallest? Is it mesiobuccal, distobuccal, mesiolingual or distolingual? Now, mesiolingual is usually the largest. Next is mesiobuccal. Mesiolingual largest, then mesiobuccal smaller than mesiolingual, distobuccal smaller than mesiobuccal, and the last one is our distolingual. So the smallest is our distolingual. This is the occlusal pattern for maxillary second molar. So this is our mesiolingual cusp, right? This will be our mesiobuccal cusp. This will be our distobuccal cusp. And this is our distolingual cusp. So obviously you can easily appreciate that distolingual is the smallest here. So basically there are 4 cusps present in maxillary second molar: mesiobuccal, distobuccal, mesiolingual, distolingual. Mesiolingual is the largest. Mesiopalatal or mesiolingual is the largest. Then we have mesiobuccal. So mesiolingual largest, followed by mesiobuccal, followed by distobuccal, and the smallest is distolingual. Okay. So you can be asked which is the largest cusp, or you can be asked which is the smallest cusp. So largest is always mesiolingual and smallest will be our distolingual. Plexus of rash cow is present in cell-free zone, cell-rich zone, pulp core or odontoblastic layer. These are basically 4 layers of pulp, right? First will be our odontoblastic layer, then comes our cell-free zone, means there will be no cells present. Cell-rich zone, which will have fibroblast cell, undifferentiated mesenchymal cells. And last is pulp core, which will have basically nerve fibers, nerve bundles. So, plexus of Reshkow is basically present in cell-free zone. It is present in cell-free zone. Cell-free zone is also known as zone of Well. It is subodontoblastic layer. Usually, after the formation of dentine, the odontoblast move towards the pulp and they occupy this cell-free zone. So, it is also known as subodontoblastic layer, zone of Well, or Hoyle's layer. Right. The cell-rich zone is next to the pulp core and it blends with the pulp core. Mainly this pulp core usually comprises of blood vessels and it present below the cell-rich zone. Here we can see. Nerve bundles usually enter the tooth through the apical foramen and they form plexus of nerves near the cell-free zone, which is known as plexus of Reshkow. They are basically, they consist of sympathetic fibers from superior cervical ganglion and sensory fibers from trigeminal nerve. Sensory nerves of trigeminal nerve. Now, next question. Type of collagen present in von Korff's fibers. This von Korff's fibers we have seen in dentine topic, right? So, basically type of collagen is type 3. It is type 3. Type 3 collagen is present in von Korff's fibers. So, von Korff's fibers were present where? They're present in mental dentine, the first form dentine. This von Korff fibers are larger diameter fibers. They can be stained with silver stain, agirophilic fibers. Remember now? We have discussed regarding our lectures. So, they are basically type 3 fibers are von Korff's fibers. They're present in mental dentine, larger diameter fibers, right? So, they are large diameter, agirophilic fibers, silver loving fibers, and they are usually laid down perpendicular to the future dentino-enamel junction. So, basically von Korff's fibers we see in where? Mental dentine, and they are larger diameter fibers and they are mainly type 3 collagen. So, correct answer is type 3. This is very important and again an easy question. We have recently discussed this. New gene involved in odontoblastic differentiation. PHX1, P53, PLAG1 or MAP1B. So correct answer here is MAP1B. For dentine formation, we have two stages, matrix formation and mineralization. For matrix formation, first we need odontoblast differentiation. So for odontoblast differentiation, we have MAP1B gene, and for dentine mineralization, we have FEX gene. So you can be asked either way. Which gene is involved in dentine mineralization? Then FEX gene. Or which gene is involved in odontoblast differentiation? Recently asked question, which is MAP1B. Identify the stage of amylogenesis marked by letter 5. Is it formative, morphogenic, maturation or organizing? So which are the stages of amylogenesis? MOF, MPD. Right. Morphogenic, organizing, formative, maturative, protective and desmolytic. So in fifth, we can see what? We can see amyloblast cells having this type of cell having ruffled border. It is having ruffled border. The amyloblast cell is having ruffled border. So this is basically a stage of maturation. Before that, we can see enamel being laid down, right? So enamel is basically formed. Hard tissue is formed. Now, what is the next step? Matrix formation is done. Mineralization is remaining. Maturation is remaining. So for maturation, we need to remove the organic component, and that should be incorporation of inorganic substances. For this, the cell develops ruffled border for incorporation of inorganic components. Okay. So this cells develop what? Ruffled border for incorporation of inorganic components, and smooth border for removal of organic components such as protein and water. So this stage is basically maturation stage, where the cell size usually decreases and they develop ruffled and smooth borders. So ruffled border for, here we see ruffled border for incorporation of inorganic components, future calcification stage, and smooth borders for removal of water and organic components. So this is basically maturation stage. Identify the tooth shown in the image. Here we are having 5 cusps, right? 1, 2, 3, 4 and 5. So 5 cusps are basically present in mandibular first molar. So it is mandibular first molar. This will be mesiobuccal. This will be distobuccal. This smaller cusp will be the distal cusp. Mesiolingual and distolingual, right? Now, which will be the mesial surface? This will be the mesial surface. This will be the distal surface. So always consider mesial surface towards the midline. This is our midline, right? So this is our mesial surface. Here we are having our mesial surface. So this is our left side. Don't consider it as tooth numbering system. Normal left side and right side. So as we are having this mesial surface towards the midline, this is our correct position. So it is of right side. So it is right mandibular first molar. It is right mandibular first molar. If we had kept here, then mesial surface would have been away from the midline and it would have been incorrect. So left is not the correct option. Right is the correct option here. Look at the following histologic section. Which part of oral cavity you find this mucosa? So in this diagram, what we can appreciate is epithelium, connective tissue. This is our epithelium. This is our connective tissue. And here, this is the bone portion, right? So basically here we are able to see what? We are able to see bone that is covered with connective tissue, that is lamina propria, numerous fibrous tissue. This is basically a type of mucoperiosteum. The connective tissue is directly bound to the underlying bone, mucoperiosteum, such as in hard palate, which is an example of hard palate. So basically, this diagram, we can appreciate epithelium, connective tissue, not only bone, we can appreciate connective tissue also, but connective tissue is covering the bone portion. So this is mucoperiosteum. If it would have been floor of the mouth, then only connective tissue would have been visible. Lining of maxillary sinus is having pseudostratified epithelium. Stratified epithelium. Buccal mucosa again as elastic tissue. So basically only connective tissue, no bone. But here we can appreciate bone. So it is a mucoperiosteum. Coming to our last question. Which kind of secretion is shown in the following image? Here we can see the secretory cell is intact, only the secretion is seen. Intact cell. So intact cell will be basically in merocrine secretion. So merocrine is the correct option. In case of apocrine secretion, we can see apical end of the cytoplasm along with the secretion. And in holocrine, whole cell, degenerated cell can be seen. So basically, merocrine is what? Secretion exits the cell via exocytosis. There is no cell damage. Always remember, when the diagram shows no cell damage, then it is merocrine secretion. Apocrine is basically part of cytoplasm is usually lost. Here you can appreciate this portion is seen. So part of cytoplasm is lost. It is apocrine. And in holocrine, you can easily appreciate whole cells, degenerated cells in the secretion. So this is the difference between merocrine, apocrine and holocrine. Merocrine, no cell damage, cell intact. Here only apical portion of the cell, apocrine. And holocrine, whole cell you can easily appreciate in the secretion. Autocrine and paracrine. Autocrine is usually secretion of hormones or chemical substances which act on their own receptors. They bind to their same cell receptors. Paracrine to the neighboring cells. So this was also one of the recent question asked, image-based question. So these are some of the previous year questions which we have discussed. Some basic questions, right? So you can be asked image-based question, numerical question, and you can be asked regarding the eruption timings of the tooth also. So please go through such type of questions also. So merocrine, apocrine and holocrine, I don't think now you might be having any doubt. Cell intact, apical portion, apocrine, and holocrine, whole of the cell is damaged. So till then, study well and all the best for your upcoming exams.